Alright, let's take this question. Pause the video and read the following question, but remember, you have about 1 minute per question. Let's break this question down. All questions follow the following pattern on the right of the screen. Our most important task is to pick out as quickly as possible what the lead question is. When approaching a clinical question like this, it is important to first quickly skim through the entire stem to identify the key clinical features and understand what they are asking. The last sentence of the question stem may not always be the lead question. It could just be part of the context. So instead of fixating solely on the final sentence, take a moment to scan the question quickly to gather all the relevant information. This includes the patient's symptoms, history, diagnostic results. In this case, the question asks you to identify the most likely diagnosis for a 55-year-old male with progressive shortness of breath, a dry non-productive cough, fatigue, and a history of smoking. The pulmonary function tests indicate a restrictive lung pattern shown by a decreased total lung capacity and vital capacity with a preserved FEV1-FEC ratio. The CT findings of diffuse interstitial markings and honeycombing are key diagnostic clues. Remember, in obstructive lung disease, there's difficulty getting air out of the lungs. This results in a reduced FEV1 because it takes longer to exhale. In contrast, in restrictive lung disease, the issue is with inflating the lungs, meaning the lungs can't fill as much with air. You try and try to take in a deep breath, but can't expand the lungs fully. However, once you exhale, the air comes out quickly, so the FEV1 may actually be normal or higher compared to obstructive diseases. The key difference is in how the lungs are affected. Obstructive diseases limit exhalation, while restrictive diseases limit inhalation. Once you've identified the main clinical features from the stem, you can proceed to evaluate the answer choices. Idiopathic pulmonary fibrosis, IPF, is the most likely diagnosis, as IPF typically presents with the clinical signs described: progressive dyspnea, non-productive cough, and a restrictive pulmonary pattern. The CT scan showing honeycombing, especially in the lower lung fields, is a classic finding. Although COPD can present with respiratory symptoms, it typically shows an obstructive pattern on pulmonary function tests, with a decreased FEV1-FEC ratio, and would also show hyperinflation on imaging, which is not present here. While sarcoidosis can cause restrictive lung disease, it usually affects the upper lung fields and is often associated with systemic symptoms, such as skin lesions or enlarged lymph nodes, which this patient does not have. Asthma is an obstructive airway disease and would typically present with a reversible bronchospasm and a reduced FEV1-FEC ratio, which doesn't fit the patient's presentation or the findings on the PFTs. So by skimming the question stem and quickly identifying the key features of the case, you can confidently conclude that the most likely diagnosis here is idiopathic pulmonary fibrosis. Okay, let's take this question. Pause the video and read the following question, but remember, you have about 1 minute to answer each question on your test.